Hey everyone, welcome to nursing class where today we're really going to be looking at IV and IV catheters. IV is a generic term for intravenous, and so really there's lots of different types of IVs. There are peripheral lines, which are usually put in the arms. Sometimes you might see them in a foot. That's really rare. You might see them in little kiddos on their scalp. So IVs, intravenous, peripheral lines are probably our most common ones that we see, especially post-surgical and in labor and delivery, all that kind of stuff. Then we have central lines, and central lines are a little bit more of a procedure to get in. They're usually put in by somebody who is specifically trained in them, and it changes how we care for them. So it's really important that we know the difference between a peripheral line and a central line. Now, it sounds kind of funny, but it's all about the tip. It's about where the catheter ends means what type it is. So if we have one that ends in the peripheral, like a peripheral IV, here's an example of one. You can see how kind of short that tubing is. You're going to put that in, and that's going to stay in the peripheral space. Versus if you have a central line, something like this is a PICC line, a peripherally inserted central catheter. The tip is so long, it's going to actually end in the center of the body in the superior vena cava, which is really great for when we want to give some pretty concentrated medications or some pretty hard medications, to have it in that big space so that it's diluted really well. Also giving our vasopressors or any of that kind of stuff where we have to keep tabs on, is that medication being effective or not for the patient. Really great to be in the central space. But for things like fluids, maybe some Zofran or some morphine, a peripheral line is just fine. When it comes to peripheral lines, there are different sizes. So it is always nice. Be nice to your nurse, because she or he does pick the size of your catheter, Foley and IV. So this is a 14 gauge. This one, if you don't like me a whole lot, I'll know it, because this one's gonna hurt when it goes in, versus this is a 22. Now, there are times when we need different sizes. If I've got somebody who's bleeding out and I need to get in some fluid and I can't get a central line in quick enough, I want a big access device. I want a nice 14 or a 16. Versus if I have somebody that is, just getting a little fluid before surgery or something like that, a 22 might be fine. 18s are kind of green, 20s are kind of pink. You can see in this, these are both 18s. They're both green, but they look different in their different sizes. It's just whoever makes them. So you have to really get used to whatever facility has, because they're all different and depending on the brand and the make. So we've talked about peripheral IVs, most common, most often seen. They're usually only good for about 3 days, so they're not going to be our long-term thing. We move into central lines. They're going to usually be in for a little bit longer. However, if we get somebody who has a central line like this, which is an IJ, an intrajugular, we're going to be really cautious with it, because that's a really short step from here to the superior vena cava, right? That's a real quick way that we're going to go, and so that increases our chance of infection, right? Short tubes, short time before infection sets in. Long tubes, longer time for that bacteria to climb up. That's why we're seeing a lot of PICC lines. And this is a single lumen PICC, which means it only has one port of access. For an ICU nurse or an ER nurse or anybody that's trying to do a lot of different medications, this is really dumb. All right, we want something that has significantly more lumens. We can give a lot more medications faster through that. But if you've got somebody who's like long-term antibiotics, or just needs TPN because they've have hyperemesis or something like that, this will work perfectly for them at home and is a lot easier to manage than if they had like 3 lumens hanging off of it. You can see by this tubing that it's nice and long. This is going to be inserted out on the peripheral space here, and then it's going to go up all the way into the center. So where's that tip? That tip is in the superior vena cava, just before the heart. It's in the center of the body, making it a central line. So that's really important for us to understand. The scope changes between central lines and peripherals. In a central line, LPNs cannot initiate access, which means if I've got somebody right here, sorry, my table's kind of wiggling. If I've got somebody right here, I cannot do this with this one. I cannot initiate the access. If it already has something flowing through it, I can add to it, but I can't initiate access. Registered nurses, they can kind of do everything with these. Very special registered nurses put these in. Other types of central lines that we have, so we talked about the IJ. It can also be a subclavian, which means under the clavicle, subclavian. You've got a tunneled cath here. That's a nice, those are usually for really long-term access. And then over here, you can't really see it, but this guy has a port, which is, again, another type of central line access device. We can put a needle in here. It's called a Huber needle. I've got an example of one here. It kind of looks like a little fang claw tube thing. You take this and you would put it with a stereo procedure directly in the space. Remember, this is going to be a registered nurse that's going to do this, and usually a pretty good trained one, because again, that's not, a port is not something we see commonly in patients that don't have chronic conditions. This is going to be somebody that has MS and is coming in for every 3 week or every month infusions, somebody with chemo that's coming in for a lot of different infusions, and we have to work with them. So you can kind of see, this would be a sterile process. Everybody would be wearing masks, you'd be having sterile gloves, the whole shebang. But it is a sharp needle, so we'll just kind of leave it in there to keep it safe. And then he does have, our little Chester chest does have an example of a PICC line with 2 ports here, or 2 lumens. And so that's something that we will see. We have to make sure that we're taking care of each lumen separately. If anybody has, it's like having multiple IV sites, you would take care of each spot. Anything that is going into your patient or connected to your patient is really important that you make sure that you do documentation and look at and take care of, because it's still your patient. Even if that's not in your scope of practice, you still have to be aware of it. Something we kind of talked about, these lines on the IJ, they're really short. So again, that infection risk is so much greater. You have a PICC line that keeps going, and so our infection risk is less. It's still there, so that becomes something that we have to really prioritize and work with. When we're looking at supplies for IVs, every facility is going to have different supplies. This is an IV start kit, and this is an IV start kit. They both look different, but they both have the same things in them. Tegaderm, a tourniquet, some cleaning stuff. Your catheter, however, is going to be something that you get on your own at your own time, because again, you get to pick the size depending on the patient and depending on what's going on. If you have a little old frail patient with real soft frail skin, you're probably going to pick a smaller gauge needle. You don't want to puncture that big of a hole in there. But if you've got somebody who's like a firefighter and good and healthy and they're bleeding out, I want a bigger gauge needle. So it really depends. Next thing you're going to want is some sort of extension tubing. I call it a pigtail. So you'll often hear me say pigtail. See, again, same kind of thing, but look a little different packaging. You'll get used to the supplies in your facility. So like I have here, I have a peripheral line hooked up with extension tubing to an adapter or a clave. And it's really important that we have all of this, because that is now called a saline lock. When we have it in someone and it's in them, and then we can saline lock it, now I can access or de-access that if they go for a walk or if their antibiotics done. It allows them for more freedom and keeps the IV going longer. Hopefully this helps with just a little quick crash course on IVs. Remember, it's all about the tip. Is the tip in the center of the chest, or is it out in the peripheral? LPNs can do stuff out in the peripheral. They cannot initiate access in that center line. That's just how the scope is written at this time. Make sure you do pay attention to your scope at your different facilities and in your different states, because it does adjust and change between them. We'll get together and we'll start working on poking mannequins and getting some blood and getting messy and having fun, and hopefully this will help you get started with it.